I don't know how many of you here have a social media account on LinkedIn. Anybody have a LinkedIn account? Okay, so some of us, about half a dozen, maybe more. Last year, LinkedIn did a survey, and they found that the most sought after skills for hiring managers and employers was communication, the number one. Pretty sizable. Those of you who are involved in patient care of any kind, medical, dental, et cetera, behavioral health, probably know the research is very strong, showing that if you want somebody to adhere to a treatment plan, your communication has got to be good, right? If they don't understand what the treatment plan is, and in some cases, if they don't understand why you've given them that treatment plan, you're going to run into issues, right? So we know communication matters, and I think part of our goal here, I'm going to talk a little bit about the how. How do we communicate? Because I think we have to step back, take a deep breath, and think this carefully through. Dr. Johnson's going to take you in a deep dive on what we should communicate, what we know about the evidence, the science around fluoride and fluoridation. And so let's just dive right into it. One of the problems I think we have in public health, among many, is we sometimes get afflicted with something that is called the knowledge deficit model. Now that's fancy language for people would do all of the healthy things we want them to do if they just heard us, if we sent them some more fact sheets, if we talked to them more, right? It's kind of like more communication is gonna solve the problem. And it's a little trickier than that, right? It's not always about more communication. Facts alone, as we're finding out, right, as we speak, are not always enough to carry the day. And part of it is sometimes the way we communicate those facts get very technical, get very scientific, and people don't always understand where we're coming from. Also, facts need some context. Context is really important to make them relevant. And then the key thing here, I think, is trust. Trust is deeply, deeply important. Now, the good news is, one of the things we know is that health providers, regardless of people's political leanings, are highly trusted. People say, over 90% say, I trust my local physician, to steer me in the right direction. Now, when it comes to state and federal agencies, when it comes to organizations, it gets trickier. That trust starts to fall. So trust is really crucial. And something we need to keep in mind is, before they trust your facts, they have to trust you. It's not just about trusting facts. Do you trust the messenger, right? So I've had dentists and physicians for years tell me, well, Matt, this was crazy. This patient of mine said that, her cousin told her this, and so that's what she was believing, and I don't get that. Why would she trust her cousin? I said, well, do you trust your cousin? He said, well, yeah, but not about medical stuff. I said, well, but do you trust them, right? Trust is huge. It really is, especially in a world where we go online and we don't always know if what we're seeing is real or not. So let's just keep that in mind. It's not about trusting facts, it's about trusting messengers. The good news is we start from a very good place. We know that we have to communicate in plain language, right? This is just one quick example. The language we talk when we're talking to each other or we're going to conferences, and this applies whether you are a social worker, community health worker, a dental provider, a water operator, right? Water operators have a technical language all their own. Most of us in this room wouldn't have a clue what they're talking about, right? They're highly trained, they have a tremendous amount of expertise, they run their water systems with precision, right? And the way they talk to each other is not probably going to work too well if they're talking to a water customer about what they did today, right? They'd have to change that language. And so we have to change our language as we talk more to our patients, to the public, and to policymakers. So I'm going to walk through 5 strategies that I think are really important for us to think about here. And I want to encourage you to look for opportunities in the coming weeks and months to have conversations. They don't have to be with audiences this large. They don't have to be with more than 3 or 4 of your friends or neighbors at a backyard barbecue, a picnic, leaving church, whatever, look for opportunities to have conversations. And I want to talk about how these strategies would apply. So I watched morning TV, and there was an interesting stat on there. Some gentleman just wrote a book, and he said, in the year 2000, the average person changed tasks every 3 minutes. Every 3 minutes. In 2022, the average human being changed tasks every 45 seconds. 3 minutes, 45 seconds. So we are moving faster, we're jumping from task to task, so it's easy to get distracted. So let's talk about how do we connect with somebody and hold their attention. Because I've seen a lot of people who are brilliant, great ideas, interesting things to say, but they don't grab their audience right off the bat. And we've got to get people's attention, right? Very important. That first 60 seconds is huge. If you don't get somebody's attention within 30 to 60 seconds, you've lost it. They're going to look down at their phone. They're going to daydream, right? And I'll confess, I'm the same way. If I'm on a web call or a webinar, or I'm in a large meeting and I just don't see how it applies to my life or my work, I start to zone out a little bit, right? So we don't want that to happen. So whether you're talking to patients, whether you're talking to people in your community, to neighbors, to friends, to civic organizations, right? A lot of you belong to different organizations, the Lions Club, Women's Club, groups affiliated with your church. There are opportunities here. So how do we get their attention? How do we connect with them right away? Well, one of the strategies is express a view or value that your audience shares. Now, you're not a mind reader. You're not always going to know for sure, but there are things you can do here. For example, right, I don't think there are too many people who would disagree with this point of view. It's less expensive if we prevent disease rather than waiting for it to happen, right? Think about something right at the start that people will say, well, yeah, of course, that makes sense. Yeah, I'm on board. Yeah, I agree. Families are struggling with the rising cost of living. Any decision that might raise dental bills, that would make things worse. I don't think there are many people out there who would say, well, no, that's not a big deal, right? We know in our communities many people are living paycheck to paycheck. This is also another strategy to think about. Share a fact that may surprise someone. So I got to tell you, I've worked with a lot of oral health organizations, and I've talked to a lot of reporters across the country. Small town, big city. The number of times I have told a reporter, and I'm talking health reporters, I'm not talking about a real estate reporter or an education reporter. I've said, tooth decay is the most common chronic disease for children and adults in America. Number one. And I start talking, and they're like, wait, hang on a second. Matt, back up. What did you just say? That's what a New York Times reporter said to me. Tooth decay is what? People don't know this. People don't know this. Even health reporters, Wall Street Journal, Boston Globe, New York Times, Dallas Morning News, right? These people have a lot on their plate. They're covering stories. We can't assume they understand that context, right? We talked about the context. So, that's something that we need to communicate, make sure people know about. A lot of people don't know this. The U.S. Defense Department has a regulation that says that if a military base owns its water system, it needs to be fluoridated. Now, why would that be? There's a memo that lays it out, and it says it's military readiness. If you deploy soldiers overseas in a combat theater and they get an abscessed tooth, they've got to be airlifted out. The cost of that is immense to pull people out who might have an abscessed tooth, who might have a serious issue. And they obviously are in no position to fight. So that's not good for our military defense. And the Defense Department says it's not what I'm saying. And then last but not least, I think this is very important. People can get cynical these days and kind of wonder, well, what's your motive and why do you do what you do? But I think it's important that we make it clear to people who may not know us why we do this work, who we are, that you've got roots in this community. It's basically saying, I've got skin in the game. This is my community, I care about it, and I want to see people healthy and happy in this community. And nobody wants to live in a community where disease is rampant, where lots of people have toothaches, where lots of people have other health issues, right? So whatever role you play, I think it's important, just briefly, to make it clear that you care about this issue. This isn't just something, you thought of this morning and wanted to talk about. So this is kind of a roadmap for your remarks, I think. Number one, connect with your audience. Have a couple of points. You might get to a third point, right? A lot of times when you're talking at a public meeting, whether it's school board meeting, city council, county commission, right? You may not get to a third point. They may say, well, 2 minutes. You've got a maximum of 2 minutes or 3 minutes or whatnot. So you might not get to your third key point, right? But really, off the bat, so important, connect with your audience. How you talk about yourself and how you talk to your audience is huge, right? You could say this, but the problem is there's a fine line between speaking with confidence and speaking with arrogance. And we don't want the latter, right? I had a dentist who was talking this way, and I said, you don't say no-brainer. He said, well, but Matt, it is a no-brainer. I said, well, I understand what you're trying to say, but the problem is what you're implying is anybody who is doubtful at all, they don't have a brain. We don't want to say that, right? Let's not be disrespectful. Let's elevate, right? Let's avoid language like that. So avoid this, and instead, let's present ourselves as resources. We have information we want to share. We understand it's their decision. Your opinion about fluoride and your family and yourself, that's your decision. We respect that. We're going to do the best we can to tell you what the evidence shows, tell you what we've experienced in our practice, etc., so that you can make an informed decision. So let's be respectful, let's be confident, but let's not cross that line, right? One of the things that I think is harder for us is most of us in this room, especially those of us in the trenches of providing care to populations in high need, is we know there's a problem, so gosh, everybody must, right? It doesn't work that way, right? So before we even mention the F word, we've got to make sure that our audience understands what we're seeing, what we're experiencing in our communities. Tooth decay is way, way down from what it was 50, 60 years ago, but it has not disappeared. So before anybody says, well, I understand why we fluoridate the water, they've got to understand that there's still a problem, and that problem could get worse if we take that away. So we've got to talk about this. A lot of policymakers, some of them live in communities where they don't see a lot of tooth decay. They may not see it in their own households. They may have dental insurance, they may have a lot of resources, they may have learned from their parents how to take care of their teeth. They may not live in a food desert, so they've got access to fresh fruits and vegetables. So we cannot assume that these people understand the disparities out there and where people are not getting care and able to take care of their teeth. So these are really important things we've got to get through. Now, this was the last third grade report I saw on the website, so Tommy, tell me if I'm wrong, but I think it's roughly about 1 in 2. So basically half of all third graders have at least had one decayed tooth, right? This problem has not disappeared. We've learned, we've brought it down thanks to fluoridation and better education and more access to care, et cetera, but the problem is still there. We've done a little better job of managing it, but there's still big gaps. There's still big gaps, right? And think about it, almost 25% of third graders had at least one active untreated cavity. Now we can only guess how many of those cavities could balloon into something much, much worse, right? So we've got to establish that there's a problem, right? Hey Houston, we got a problem, okay? The other thing too is we've got to go well beyond the mouth, right? It's one thing for somebody to say, yeah, I get it. Nobody wants to have cavities and toothaches, I'm sure they hurt. I haven't had one, but yeah, I get it, yeah. Tooth problems, yeah, I get you. But they need to understand, and we need to do a better job of educating them about the effects that this has well beyond the mouth, right? Very good research. North Carolina study. Children with recent dental pain were 3 times more likely to miss school than their peers. 4 times more likely to earn lower grades, right? So here's the deal. If you care about better schools, you need to care about oral health, right? They asked young adults, what are some of the factors that affect your ability to get a job? 3 in 10 said the condition of their teeth and mouth, they feel, affects their ability to interview for a job. So now suddenly we're talking about the job market and holding a job, getting a job, right? There was a journal run by the American Heart Association, very reputable journal. It says there's a clear link between tooth decay and a higher risk of stroke. And this is just the start of it. We could go on and on. We know there's linkage between diabetes and poor oral health, et cetera. So let's make sure people have some understanding that this is not just about filling a tooth or so. Analogies can be very helpful for us. We need to take those into consideration. I find that if you use an analogy that connects people with something they already know, you're going to be on pretty firm ground. So, and there's actually research that backs this up. This isn't just intuition, right? When they used an analogy to explain what diabetes is, what that diagnosis means, patients were much more likely to understand what that meant than if they just used a traditional kind of pull it out of a medical textbook kind of explanation. This is something that we hear a lot. And if you think about it, if you don't know much about the science behind fluoride, this isn't a crazy question to ask, right? Hey, if you want fluoride, you just go to the grocery store and buy fluoride toothpaste, right? Well, there's a reason for this, right? We know that the amount in water is really designed to give us that kind of constant throughout the day kind of exposure that toothpaste only gives us twice a day. And that's assuming we brush twice a day, right? So you get a very intensive exposure using fluoride toothpaste, but the water, you get a low level in there, so it keeps some in the mouth kind of regularly. So I think one of the best ways to approach this is to say this is really like airbags and seatbelts. They work in complementary ways. It's not a choice of one or the other, right? Both of them are helpful in different ways. So think about that as an approach. We hear this a lot too. Well, you know, how come there's a warning label on toothpaste? Doesn't that mean that we should be fearful of fluoride? You can go into a drugstore, grocery store, look at vitamins and minerals, and on a number of them you'll see similar warnings, right? We, as a society, we err on the side of caution. And it probably helps that we have a bunch of lawyers who tell us you should err on the side of caution, right? So we want people to know everything there is to know. And if something could possibly cause an issue, we're going to let them know about it, right? So that's an analogy to consider. People will ask about, what about individual responsibility? Isn't this just, people have to take care of their own teeth and that's that? But think about it. When it comes to protecting homes against fires, that's not an individual responsibility, partly, but we have these things called fire departments, right? And we have fire codes. So it's not all on individuals. It's part individual and part community, right? We have that balance, and I think protecting teeth is similar. So think about analogies. Now, I will tell you, if you think of an analogy, vet it with someone. Try it out on somebody and see how they react, right? And preferably try it out on somebody who's not in the same exact field that you are. And just get their honest feedback, right? It might work, but it might not work, right? But we have to think of it. Analogies kind of give us a shortcut. They kind of connect us with something that somebody already knows or realizes. So this, I think, is a very important one. Dr. Johnson very soon is going to walk you through a lot of data. What we know, what we've learned about fluoride, about teeth, about some of the claims that are made about it. And one of the challenges we have is how do we make people remember that and feel it, right? If they can't feel it, it's only going to go so far for us. So what do I mean by that, right? So They've actually found this with research. Messages are actually more trusted if they include data. So that's the good news. People do want data. They just don't want to be overwhelmed by it. So data in moderation, experts tell us, and it's got to be remembered, right? The whole point of this is, what do I remember hearing when I read a newspaper article, when I turned on the TV, when I was going through my Facebook feed and somebody posted something about this, right? And is it relevant to their own lives? Very important. Here are a couple of data points that have been out there in the past, several years, right? Several months, actually. And our world tends to use these data points a lot. The 46.16, that is adjusted by inflation. That used to be $32.19. So, so why doesn't this data sink in? Many of us look at this data and say, hey, yeah, why would we not have fluoridation, right? This is such an important thing. Here's the problem, though. Experts tell us that numeracy, people's ability to remember and recall numbers and make sense of them, is not high. And we don't help it when we throw decimal points in things, right? You want to have decimal points in your Excel spreadsheet, in the back of your report or your manuscript, I get it, that's fine. But in normal conversation, it complicates things, right? Because what experts say is that people are trying to remember two different numbers. They're trying to remember what's on the left side of the decimal point, and they're trying to remember what's on the right side of the decimal point. So they might walk away and go, yeah, 24.5 million, or was it 42 point, right? It just complicates their ability to recall. So that's why we want to just say 25 million or $46. It's more easy for people to remember that, right? Also, one of the problems we have is we can throw numbers that are so huge at people that I think they just get overwhelmed. They don't really know, what am I supposed to make of this, right? 25 million more decayed teeth. Well, who's going to get those cavities? And how many of them are going to be here in Alabama? And what kind of kids? Like, what are you telling me here, right? So we have to be mindful that really large numbers are going to sometimes raise more questions than they've answered. The $46, some people will consider that important, but some people may go, nah, $46 over an entire year. I mean, yeah, I guess, that may not impress a lot of people. So how do we make them feel the data? One of the things a lot of people don't realize is you get a cavity in a tooth and it starts the clock. It's not just a one event, okay, you go and then you get a filling and done for the rest of your life. It starts a long clock of these kinds of procedures. And even if you don't end up getting an implant, right, you're still over $3,000. And that's one tooth. And we know how many molars you have in your mouth. So, I mean, you start multiplying it. That's a lot. That's a lot, right? That starts to have an impact. And $6,160 is not such an immense number. People know what that means, right? That's a lot of money. We know that many people live paycheck to paycheck. And one of the examples just to say is, look, if you take your child in and dental office finds they've got 2 cavities, maybe one's a 2-surface cavity, one's a 3-surface cavity, that can easily cost in excess of $700. And so if you're a parent, you don't have dental insurance, and a lot of parents don't. It's much less common to have dental insurance than have medical insurance. This starts to add up. How do you pay for that? Most people out there do not say, oh yeah, if I get a bill for $700 this month that I wasn't expecting, yeah, I just kind of write a check and done, right? It doesn't work that way. A lot of people are going to struggle to find money to pay that. Let's talk about personal choice, because this is a pretty emotional argument. It's a values argument, and those of us in the public health community, we're about facts. So we want to answer everything with facts. We've got evidence. We're going to share it with you. And the problem with that is that the choice argument really isn't about a fact. It's about a value. It's about a value that people hold. And the truth is, on some level, I think most every one of us believes choice, freedom of choice in certain contexts is really important, right? So there was a survey done recently. They asked, should the government prioritize the collective health of the population, even if it's at the expense of individual decision making, or should it go the other way? Should it prioritize individual freedom? It was somewhat divided, but there was a larger group that said it should prioritize individual freedom. So, you know, I think that's a very American mindset. We do appreciate our individual freedom. And so people will bring that argument up. Well, but shouldn't people have the choice whether they want to use it? So what can we say? Is there anything we can say? Or do we just say, well, we don't really have a study to answer that? But I think we've got to say something. And I think we have something very useful to say. So what if we say something like this? Right? You want to talk about choice? Let's talk about choice, right? Children don't choose who their moms and dads are. They don't choose whether they grow up with a family that has a lot of money, has dental insurance, whether they live within 3 miles of a dentist or 40 miles from the nearest dentist, 60 miles from the nearest dentist that takes their insurance or Medicaid. Do they live in a food desert? You know, those are things no child gets to choose. That's just their reality. But if we believe all children deserve to have an opportunity to grow up with a healthy mouth, then we realize fluoridation helps to make that possible. Because it means that everybody in a community, children and adults, no matter who they are, no matter what their income, what their race, what their gender, what any of this stuff, they get a basic level of protection, right? And we want to talk about choice. We know there are some people right now who don't like the quality of the water or don't like the smell or have some complaint about it, and they're already drinking bottled water. And that's, you know, that's their right. Many of them do that. They may have a water filter, right? No one's saying they can't use that water filter. Of course, if that's the decision they want to make for themselves or their families, you know, they can do it. So I think we have some good, meaningful things to say about choice, and we shouldn't feel like we have to kind of tiptoe away from that or around that. We can talk about choice because we don't think that any child should be punished because they didn't choose, you know, what zip code they grew up in and whether their parents have dental insurance, right? So these are the 5 strategies I just walked you through. I hope that this might get you thinking, strategizing, brainstorming about different approaches you can take, thinking about opportunities to talk with you know, people in your community about this issue and what's at stake. I think we've got some great messages, and it's just a matter of us thinking through how to deliver them, right? Thinking a little more that way. So I want to close by sharing a few resources with you. For those of you in this room who want a deep dive, lots of detail, footnotes, everything, the American Dental Association has a document called Fluoridation Facts. It is the encyclopedia of fluoride as far as I'm concerned. Basically every question that you've probably ever been asked is probably answered in that document. So definitely something to look for. Access it. I think you'll find it worthwhile. Now, what about patients and the public? Most people are not interested in reading things that have little numbers up on the right side, and they're having to kind of comb through and hearing about confidence intervals and stuff like that, right? We need something that is accessible and is in normal English, plain language. I highly recommend this document, and I will confess I helped to write it. It's a document called Fluoride Questions Parents Ask, and it is written in plain language. There is no sentence in that document that is more than 20 words, and that was done deliberately. The CDC says plain language is not just about the words you use, it's also about the number of words in a sentence. The longer that sentences run on, the more people start to browse and skim and stop reading it, right? So this was the CareQuest Institute for Oral Health partnered with American Fluoridation Society to produce this document. So anyway, that's my story. I'm sticking to it.